Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Hi everyone. Today, we're going to talk about spironolactone. I'm going to explain everything you need to know about this diuretic medication, what it's used for, and how to take it. So, what is spironolactone and what is it used for? It's a diuretic medication, which means it helps you get rid of excess fluid and salt from your body. This scrap, it's used to treat various conditions like high blood pressure, heart failure, and some types of swelling. It's also used to treat hormonal problems like too much aldosterone and hormonal acne. And how does it work? Spironolactone blocks the action of a hormone called aldosterone. By doing this, it helps your kidneys get rid of more water and sodium, but it holds on to potassium, which is important for your body. Now let's talk about how to take it. It's super important that you follow your doctor's instructions. The starting dose can vary, but it usually starts with 25 to 100 milligrams per day. Depending on how you respond to the treatment, your doctor may adjust the dose. Don't forget to take it with food so your body can absorb it better. Like all medications, spironolactone can have some side effects. The most common ones are dizziness, headaches, and changes in your potassium levels. In rare cases, it can cause more serious problems like kidney problems or allergic reactions. If you notice any unusual symptoms, tell your doctor right away. In short, spironolactone is a useful medication for several conditions, but you should always take it under the supervision of a healthcare professional. Follow your doctor's instructions and don't forget to get regular checkups. Thank you so much for watching this video. If you have any questions, leave them in the comments. See you soon.
If you've made it this far, let us know in the comments why you're using this medicine.